need to get um, up to speed and get a plan in place for the next 5 years for that building. There's a lot of stuff down in master control that's not in the planning that needs to get done. There's some things that need to be replaced, like chairs. These folks sit in these chairs 24/7. So we're working on getting a future plan, not being so reactive. So that's been going well. And also, we'll be talking about the repurposing of the current highway department on Thursday at Buildings and Grounds. And I believe that's it for me.
Okay, very good, Melissa. Thank you. Does anybody have any questions? Okay, seeing none, we'll move on to the second report, the Prevention Council update and emergency housing needs with Prevention Council Chair, AODA Prevention Specialist, Mary LeBlanc. Mary?
Thank you. Mr. Chairman, County Board Reps, guests, thank you for allowing me to present tonight. What I would like to do is first introduce myself. I am Mary LeBlanc. As Mr. Jarvis said, I'm the prevention specialist as well as the OWI assessor and coordinator. I've been with Waushara County for 11 years. Also, I serve as the current chair of the Waushara Prevention Council. So what we wanted to do tonight was just to give you a little bit of a brief overview of what the Waushara Prevention Council is all about, and then talk about an issue that has come to the forefront in our discussions and ask for a little bit of support with that issue. So if I may proceed. Waushara Prevention Council started originally back in the late 1980s with some discussion and community organization. We became an official committee back in 1990. In 2003, we became a 501c3. As I said, we started as a way to coordinate services and prevention efforts within the county. We are one of the 3 longest standing prevention coalitions in the state of Wisconsin. However, we're a little bit different than the rest of the coalitions. Those other coalitions, and there are now currently over 80 coalitions in the state, all address only the issues of alcohol and drug abuse. Our coalition also looks at economic security for all residents, food security, specifically looking at that issue for elementary students so that they don't go hungry over the weekend. And we also look at our aging population and what we can do to help them, along with the alcohol and drug issues. We're funded primarily through a very small part of the AODA block grant that the county receives. They receive 20% of that block grant has to be spent on prevention, and our AODA committee gets about $5,000 out of that money. We also get some funding from the Central Wisconsin Foundation, the Alliance for Wisconsin Youth. We do one fundraiser a year, and that's at the Freedom Fest in Wautoma here. We take donations for fireworks, and then we split that with the city, with the chamber. The rest is from donations from the general public. In addition to the Prevention Council, which is kind of our governing body, we have several committees that are very active. We have the Healthy Communities, Healthy Youth, which addresses alcohol and drug-free activities for youth around the county. We have Waushara's Vision, which addresses that economic and food security. And then we have the Active Aging Committee, which, as I said, addresses the elderly population and what we can do to keep them active and healthy in the community. Each of those committees also has sub-work groups. Waushara Prevention Council includes 2 staff, myself and Chris as the prevention specialist and coordinator from Human Services. We have a couple of other human service folks on our committees, and we have representatives on our committees and our council from more than 17 different organizations throughout the county, as well as, most importantly, community volunteers. In 2014, we started holding excuse me, annual meetings of our Prevention Council and its committees. At those annual meetings, we generally would bring in a motivational type speaker to keep our membership up and going and enthused about what they were doing, as well as taking time to share what they were doing. This year, we did it a little bit differently. Instead of bringing in a speaker, we did what was called a SWOT, a strengths, weaknesses, opportunities, and threats activity. And we looked at what were those strengths and weaknesses, not just from the Prevention Council, but from the county as a whole. All right. And then we took the results of those, which you would have received in your packets, and we took them back to Prevention Council, and we've been discussing them and talking them over and stewing over them for the last few months. As we discussed them, we came to the conclusion that there were three primary issues in Waushara County: childcare or lack thereof, transportation or lack thereof, and housing/emergency housing and lack thereof. Okay, so we looked at those issues, we talked about them, and we decided there's already a group of people working on transportation. There's already a group of people working on childcare. So that left us with housing and emergency housing. We started with, what can we do to help out? What can we as a Prevention Council do? So what we did was, they voted to purchase food vouchers, they voted to purchase gas cards, and then they asked me to purchase hotel vouchers. Well, I bought the gas cards, and I bought the, I bought?
Oh,
Nope. Gas cards and food cards, sorry. And then I went to the hotels, and there wasn't one hotel in Waushara County that would work with me. I was not able to buy a voucher. I explained to them that, you know, the concern was, well, what if we're full? You can't use us then. And I'm like, I know, if you're full, you're full. That's great. But this would be only on an emergency, and, you know, if law enforcement or our crisis unit really needed to place somebody at your hotel for a night. And they just weren't willing to work. So I went back to the Waushara Prevention Council, and we have several officers that sit on that council, and they said, what if we pay for it up front and then we get reimbursed by the Prevention Council? So we agreed to do that, and they thought that would work. However, they said, our money is not going to last forever. Then what do we do? And we talked about several situations that have happened in recent months. There was a person who was released from one of the state prisons. His last known address 18 years ago was in Wautoma. So the prison brought him back here and dropped him off. He had no current ID, no way of cashing the check they gave him, and no civilian clothes. So what do we do with this person? We have no place to put him. They ended up taking him to Oshkosh, put him at Father Carr's for the evening until they could get him back here and get him some money and a bus ticket to Arizona, which was where he wanted to go initially. Other situations, domestic abuse victims. We have no place in Waushara County to send those people. They have to go out of county. Fire victims. We had a home fire here a couple weeks ago. Where do we put those people? I mean, I think they were put at a hotel for the night, but we could have helped them out. People who are homeless or at risk of being homeless, sex offenders. We've got to have a place to help these folks. We've all heard the expressions, it's not our problem. We've heard the expression, everybody has to be responsible for their own actions. It's the only way they learn. That may be true. But sometimes these folks just need a hand up. And if we can work together as a county, as a Prevention Council, and supporting people from around the county to help them out, it might just make enough of a positive impact on their lives that it will turn their life around. We realize as a Prevention Council that it's a bigger issue than we alone can handle. So with that, we are asking for county board to help us by creating a committee. We believe if we have a committee with not just Prevention Council, but people from around the county, and I included a list in your packet of possible people we could include on that. We can collectively realize better ideas, better solutions, be eligible for some larger funding amounts. We know that there are organizations around the state. Oshkosh, I believe, has a tiny village where they are able to house some people. Wapaka County Habitat for Humanity is working with the schools to build small houses for emergency housing for people. So the options are out there. We're just looking for you folks to agree with us that this is an important issue, and you will help us address it by being part of a committee to look at it. Questions?
It's a pretty daunting
It
thing.
is, and I talk really fast.
Any of the
I'm sorry.
problems are really daunting, but it's you know, you're absolutely right. The only way to get any of this stuff even partially solved is collaborating.
Mhm.
So I think that's a wonderful thing. And I think that we are in order to, you know, help you with that any way we can.
Okay.
So,
Perfect.
yep. Anybody else have any questions or comments for Mary? Okay.
Okay, can I, just one more thing?
Yes, you can.
I did hand out some extra handouts that weren't in the initial mail out today. It's a packet that looks like this, and I can give this to here. You got a flyer for the, it's co-sponsored by We Are in Christ and the Washera's Vision for an upcoming, thank you, poverty simulation. If you've not been to a poverty simulation in the past, and we did one many years ago. Good idea, Pat. It is a really neat event. You come in and they assign you, you know, Mr. Jarvis, you might be a single father with 3 children making $20,000 or $30,000 a year. And then they'll give you a alternative. Now you've got health insurance to pay and your car quit working. And, you know, so you talk about all these situations that can arise and helps you realize what those who aren't as financially stable as some of us have to deal with on a daily basis. The other thing I gave you is just some brochures from the Prevention Council and our committees. They're a little outdated, but we're working to update them. So
Okay.
thank you for your time.
Very good. Thank you very much. Appreciate it. Okay. Our next report will be from the Washera County Libraries, their annual report with Winnefox Library System Director Claire Ellen Summersmith and the Washera County Library Directors.
Yeah.
Yeah.
We'll just quick have everyone introduce themselves, and then I'll carry on, and then Ken will carry on. I'm Claire Ellen Summersmith. I'm the director of the Winnefox Library System.
My name is Lisa Aish. I've been at the Hancock Public Library since 2006.
Deb Sadowski, Coloma Library.
I'm Andra Maury, Town of Leon, Saxville, Pine River Library.
I'm Bernadette Birdie Steinbrook. I'm director of the Plainfield Library.
Hi, I'm Dawn Bettler. I'm the director at the Poisippi Library.
I'm Hannah Klusmeyer, the director at the Watoma Public Library.
And Kent Barnard, the director of the Patterson Library in Wild Rose. So we have a really quick presentation because most of our information, if you go to the next one, or do I have a thing? I have a thing. Woohoo. Because our information all is pretty much compiled in March. What we're comparing on these slides are 2022 to 2021. So we have 8 libraries. The county has 8 libraries. We serve 25,000 residents in the county, 10,000 non-residents. We serve everyone safely, efficiently, effectively. We offer books, DVDs, CDs, online learning, online streaming. Our patrons used over 13,000 hours of Wi-Fi last year because in many cases, we are the only Wi-Fi they can get. As you know, there's hills and valleys and trees and everything blocks a lot of signals. We've also provided over 10,000 faxes, emails, copies, and we serve as the information hub for the residents of the county. So you all got one of these. It's the only thing I'm going to make you take home, but you don't even have to do that. So we were open. We had 72,000. Whoops. I have the old one on there. I'm so sorry. This is my library. All the libraries together had 72,237 visits. We were open. It's a combination of all these. I see that now. Open 14,428 hours, 138,453 items checked out, 886 programs, 12,942 attendees at those programs, 15,240 digital items checked out, 7,000 card holders. Our circulation increased from 2021 to 2022 by 16%. We had a 295% increase in programs offered, and 278% increase in program attendance. And of course, some of this is due to COVID. And we added 10,493 items in those years, and we had over 55,080 public computer sessions and 7,000 Wi-Fi sessions, which I kind of went over before. And now I'm just going to show you just some pictures of what went on. We're going to go alphabetical because we're librarians. So Coloma, is there anything you want to say? No. So you can see they had I think it's goats, isn't it? Or sheep? Alpacas. See, I don't even know. They just sent me stuff. They did a taco bar. They've had a truck out front. There's a story time going on. We still cater a lot to everybody, but a lot to small people because they need to learn how to read. Not working. Oh, Hancock. Okay.
All ages haven't heard yet. Up in one of the adults with the pink.
And then Pine River, of course, had a big garden added on. Where's Pine River? Oh, I'm looking for Colette and she's not here. And you'll also see in some of these that we had a lot of bluebird houses made this year. I think almost everyone had the bluebird guys out, didn't they? Yeah. And we had 26 made at our library. So there's a lot of homes for bluebirds. And then Plainfield, another new-ish director.
Yeah. Dog and success with right in the center. And speaking of there's a picture of some soup down there. We've had success with baking and that's here and we serve them better. A lot of these were from fire trucks and services. Is Andy available to talk with them? Trying to make a good connection with sources. Great author program.
Red Granite. Jeannie couldn't be here tonight because she had a story time that was running until 6. They've done a lot there. Everybody's done a lot this year and a lot this summer. I mean, the slides, there may be 10 or 15 on a sheet, and there's so many more programs that we've all done. What?
Saturday market.
Oh, they did Saturday markets. That's right.
Come to Red Granite in the parking lot on Saturday mornings and have fair market. That's put on by the library. But
Watoma. You don't have to dress like a hobbit to come. And then my library in Wild Rose. Our biggest event this summer was Dino Fest, which we did from 11 to 4. We had over 100 people show up, kids. And as you can see, we also had a program where he brought dinosaur puppets, which was really popular. Up in the top right corner, we had Jerry Apps had donated money to create a Jerry Apps reading room because he had to move out of his house. So I have all of his memorabilia, and now that has been open. That was our dedication. We also did programs on Thursdays, magicians and Tailwise at Wild Rose Days. The first graders come every year to get library cards. And last year we did a program called Firsties, where they get a bag, they come in, and every time they check something out, they get to put a bead in their jar for their class. And the winning class gets a popsicle party, which it's really not much, but to them, a popsicle in the middle of school is a really great thing. So they loved it. We had Girl Scout story time this fall, and we have bottle rockets. Every year we do a water bottle rocket launch, and they love that. And of course, we had the birdhouses as well. So and that's it. So thank you for your time.
Okay, thank you very much.
Are there any questions about library services at all? Okay, we did. I just wanted to say thank you all for inviting us. Administrator Pingle invited us, and normally when you hear us talk, it's just about funding, and this is just a little highlight of the wonderful things libraries do above and beyond.
It's really nicely done. And that's the thing, all of us have fond memories of or reasons for using the library, but until you're on a library board, you really don't see how far reaching they are into the communities and how important they are to their individual communities. So thank you all very much for what you do. It's very good work. Thank you. Okay. Our next report is the Department of Human Services Annual Report with Human Services Director Clara Voigtlander.
Good evening.
Clara.
Thank you for having me tonight. I'm pleased to be here. Especially excited to share our annual report tonight because this is the first report where it's officially feels like it's my year. Last year I was coming into it, so reporting on the year prior to me being in this role. And so I'm looking forward to sharing with you our efforts from 2022. Is this working then? Should I give it a shot? You might have to just help me. Thank you.
There it is.
We have quite a few presentations tonight, so I'll try to be brief where I can. Here, what I have listed are the management team from Human Services. We have been stable on our management team for the past year. We did add in Jenna Holland, who is our new deputy director. She comes to us with expertise in child and family work, was a previous employee here as well, so we're very pleased to have her back. Thank you. So Human Services employs about 60 positions. That is made up of staff that we have in-house, as well as some contracted employees that are required under statute. We have 2 medication providers who work for us 1 day a week via telehealth, Dr. Maboob and Alexia Smith, who's an APNP. We also work closely with Dr. Kent Burney. He provides crisis oversight that again is required by statute. And then Dr. Stefanades works with us in our AODA unit to provide the medical director role there. So what I'd like to do tonight is provide some highlights on how our programs have provided quality service throughout the past year, as well as how we've been mindful of our obligation to be thoughtful about budget and how our tax dollars are applied to our constituents. So I'll go through each program. Many of our programs are mandated, so I'll add that, meaning that we are obligated to provide this service. And so we do our best to make decisions about what service provision looks like, what that cost will be, how we best deliver that service, but sometimes we are at the whim of what the year brings us. So economic support is our program that provides determination for food share, medical assistance, and childcare. What I would note here is that we did have an increase in families served. Last year we were at, I believe, 3,400. 2022 was unique in that even though many of us felt that the pandemic was ending, the functioning in our economic support unit continued to recognize the emergency declaration. So families did not need to come in for reviews for Badger Care. They did not need to come in for reviews for food share. And staff statewide, part of an initiative was that staff would be able to work from home part-time. So here in Waushara County, we have a policy that our economic support staff can work from home up to 3 days a week and then be in office 2 days a week. ARPA funds provided equipment and any of the materials necessary to make that a reality. In our AODA unit, we served less clients this year. However, what I would note is that the acuity of the clients served intensified. So for example, in 2021, we referred 15 consumers for residential treatment. This year, we referred 20. 70% of that was for opioid use. Additionally, we had increased services that we've been providing at the jail, AOD and substance use programming groups with a total of 16 participants. Our hope there is to reduce some recidivism and start services before people come out of jail and are, re-engaging in the community. Our OWI assessments, which I'm happy Mary's here because she actually provides that service for us in our agency, that number dipped a little bit, and our TAD number, which is our treatment court, stayed about average at 7 participants. In Child Protective Services, it was very similar. There's been a decrease in overall reports, but our substantiations have more than doubled. What that means is that reports of child abuse or neglect that have come in and been determined that there's a preponderance of evidence that abuse has occurred have more than doubled. In 2021, we had 15. In 2022, we had 33. So again, the acuity of the cases that our staff are addressing has intensified significantly. I'm proud to note that we had a drastic increase in the amount of children that we were able to reunify. This is a huge win. Ultimately, what it means is that children are able to be back with their natural family, which is our permanency goal in the state of Wisconsin. This also is a positive for our county as a whole because it reduces the strain on our foster families as well as the financial cost that comes with providing that important care for children who are in foster placement. We reunified 9 children last year. We had been at 2 children that reunified. So this is a significant increase. But again, we're really seeing the intensity increasing in the types of cases that we're addressing. Our Children's Long-Term Support and Birth to 3 program, these are, Birth to 3 is a mandated program. CLTS is not. However, we have seen a large influx in referrals in these programs as well. Currently, they have a great deal of attention from the state looking at changes in programming because of the influx of referrals. So for example, in 2021, we had 46 referrals for birth to 3. You can see that we were sitting at 75 in 2022. For children's long-term support, we were at 39 in 2021, and in 2022, 51. So a large growth. Both of these programs are MA funded, although part of what's drawing attention from the state is that many counties are requesting an increase in the funding for birth to 3. And under CLTS, the state is looking at improving the integrity of how the funds are used. This is a program that provides material items or respite services for children with physical or emotional disabilities, and they're trying to put some more parameters around how those expenses are used. So changes to come in the future. I'm proud to share that our Healthy Families America position and program was changed over into what we call Growing Healthy Families with Share now. This change came about because what we were finding was that the expense of our program affiliation under Healthy Families America, as well as the window of eligibility for families that could be served, was so minimal that we were not able to make a meaningful impact on young families in our county. What we did was we worked with Theta Care as well as Green Lake and Wapaka counties and ultimately developed our own home visiting program. This program is now billable, and we also are able to serve families up through age 5, where our previous program only served through up to age 2. And the other perk to it is that we own it. It's our program. It uses evidence-based curriculum, and we're not having to pay a yearly program affiliation and follow the guidelines of an external program. We had 15 families in 2022 that transitioned from Healthy Families America to this newly developed WSHERA-specific program. In our clinical services program, we saw somewhat of a decrease in clients coming through the mental health clinic. However, I would note that our clinic for all of 2022 was working at 40% staff. So to put it bluntly, it was a situation of our psychotherapists were doing more with less. Very proud to note that we were able to offer a crisis appointment every business day in 2022. What this means is that there was a therapist who was available every day for an open slot if we needed to put someone in there who needed a crisis psychotherapy session. This is an important effort because not only does it create some linkage between our actual crisis unit, but it also works to try to prevent emergency or crisis that shows up in other programs by having a skilled clinician available daily. We additionally added in a shared supervision time with our crisis unit to try to strengthen our collaboration between units. We continue to provide jail services through individual therapy sessions as well as groups. And we continue to keep a very active psychiatric clinic with an average caseload of 75. And in fact, Cindy's here, so I will note, so active and busy to the point that we've looked at shifting some of her responsibilities to be primarily providing administrative oversight of that clinic. Youth Justice is our program that oversees delinquency or truancy referrals. Our referrals were up compared to previous years. We do have some out-of-home placements, 2 successfully reunified with the Guardian, and proud to identify the Youth Innovation Grant as an effort that our Youth Justice program made starting in 2022. What it does is essentially it's a school justice partnership. This is a grant that we've had for many, many years, but you can shift the focus of it. And we did have a lapse in using this grant, came back to it in 2022, and now we're doing a school justice partnership, which essentially pulls together invested community members to look at reducing recidivism, as well as offering pro-social activities, sober events that pull together schools and youth in our communities. I do just want to share real quickly, when I talk about some of the mandated programs and how we really have to just respond to what the county brings to us. I do want to share that an example of that would be recently we had a youth who had previously been living in a different county, now has transitioned here. So ultimately we hold responsibility for providing this family with services. Our youth justice unit went into court, made a demonstration of here's all the things that we could do to try to sustain this youth in the community based on his needs and some of his youth justice charges. And ultimately the judge, determined that this is not a youth that we can maintain in the community. And so I share that as an example of how all of these systems come together really to make decisions about community safety, best practices and treatment for youth. And so in this situation, we will be placing this youth, and we're actively looking at a placement for him right now. We're hopeful that he can return to the community at some point, but I do share that with the board just to outline how when we talk about unanticipated expenses and mandated services, that's a prime example. We didn't intend to place this youth. It's happening. We're going to have to respond to that. Comprehensive community services and community support program are both wraparound programs that provide treatment services to individuals living with mental health diagnoses. What's noteworthy here is that in our comprehensive community services unit, we're involved in a 6-county consortium to provide services. One of the goals of the consortium at large has been to increase the amount of consumers that we serve with AODA diagnoses. And I'm proud to say that in 2022, we added on 7 new participants who have a primary AODA diagnosis and are providing treatment services to them. I'll have more to come in next year's presentation about our efforts to incorporate a certified peer support specialist into those programs. I was here and had asked to shift an internal position over to a certified peer specialist. The board approved that. We're grateful for that. And I'm looking forward to talking about how that's played out. This is just another opportunity to expand our treatment services. And that's been a huge benefit to both of these programs. In crisis and adult protective services, we've had an increase in calls, 69 more calls in 2022 than we had in 2021. This program covers 24/7, 365 through the holidays. We've had a tremendous amount of support from law enforcement, court counsel's office in keeping this program running smoothly. And in 2022, Keith Melvin, the director of EMS, and I started a new initiative wherein we're trying to offer critical incident stress management debriefing to community partners as well as our department. What this does is it offers trained professionals in debriefing to meet with law enforcement, fire department, and provide stress response debrief. So I'm looking forward to sharing more information about that as well as that expands. Finance. Touched on how mandated services. Also want to just make sure the board is aware that we did have reserve funds that were helping our overall budget in 2019 and 2020 and 2021. Those monies were exhausted. So obviously in 2022, what's of utmost importance is looking at increasing revenue and monitoring expense. So as you can see, we have improved the use of existing allocations and grant funds, and we continue to focus on building revenue. You can see, however, that we have stayed relatively close to what we've budgeted in terms of revenue. So that's a positive. And then same with expenses. You can see that we're staying on track in terms of what we're budgeting for expenses, trying to stay steady. And, it's the ongoing balance of providing good service while being mindful of the cost of that. So last year when I presented, these were the areas of focus that I talked about that I wanted to monitor for 2022. And I thought what would be good is just for me to do a follow-up to the board to let you know where we stand. So fully staffing our psychotherapy positions, we've gone from 40% staffing to 80%. We only have 1 vacancy there, so that's a positive. We've maintained a full management team for the majority of April 2022. We had initiated a pilot project for addressing mental health needs of employees. Although what we've ended up doing is we've worked with HR to more create a work group through the employee wellness task force for that. In terms of updating and developing necessary policies, we have updated over a dozen that relate to good service delivery, best practice of work, and just expectations around what makes us a strong unit and strong department. Our clinic work group on everything under financial, we've continued to work with our professional auditor consultant, increasing grant efforts, and then also making programs billable to the department's advantage. Some of those examples are we've had changes in our crisis billing. We've increased the rates at which we can bill our CCS program, and then changing over that home visiting program to be billable. Areas of focus for 2023, continuing to expand our debriefing options to the department and community partners, rejuvenating our drug endangered children team. And this year we were able to use opioid settlement funds to send some staff to the national conference, which was phenomenal. That'll give us a great boost in rejuvenating that program. We started in 2022 doing employee reviews yearly. This is not at all connected to wage, but it's an opportunity for us to have conversations with staff about areas of development as well as where we see their work, really aligning with what we want to do and what type of service we want to provide in human services. Improving our grant reporting and usage and continuing to work towards building a financial reserve. That might be a long-term goal, but it's always going to be on the radar. And then lastly, I always would like to share a positive story about a consumer that we've served. But tonight I felt that it was important to identify a handful of our staff who've been employed at Human Services for over 10 years. The work that we do is not possible without the staff that are employed at Human Services. And what I especially want to recognize here is that Human Services has been through a great deal of transitions and changes. And I'm grateful for the staff that you see in front of you who have all been here over a decade, for their continued loyalty to our department, as well as their continued competence and shared knowledge that keeps our department running smoothly. So thank you to all of them. And I think it's important for the board to recognize that we do have many staff who've remained with Human Services for many years, and we're grateful for them. Any questions?
Thank you, Claire. Does anybody have any questions for Clara? I have just one. Now, you said in your report that you had 33 substantiated child abuse cases, and that was doubled. Do you have any idea? I mean, you guys, can you put a finger on why? Is that post-COVID, or what caused the increase?
So actually our DHS board has asked that as well.
Okay.
Like what is happening or what is creating that? What I can tell you is I think a lot of it is reflected in what you saw of the increase in the numbers of AODA use. We've had a great number of substantiations that involve AODA use. What we have in our child welfare system is a dashboard, it's called, which provides actual numbers or data on what the substantiations are related to, and the majority are neglect, which again is connected to substance abuse. I wish I had a clear answer on more than just substance abuse, if it's post-COVID or what, but what I can tell you is it seems that it's a more strained parenting world right now.
Mm-hmm. Yeah, it is. And there's a troubling number to see something that double in a year. That's so anyway.
Mr. Chairman, I got a question.
Okay.
Is this, do you think this is a Waushara County issue? Is this, have you seen this in other counties?
It's
statewide?
global. Yeah.
Okay.
Yeah.
Good.
All right.
Good.
Thank you.
Very good. Thank you, Claire. Very good report. Okay, we'll move on then to our discussion, possible motion, action items. The opioid settlement proceeds request, one step sober living software for Amelia's men's sober living program. This must be outside of what we.
It's outside of the priorities. So that's why I'm here today. I will tell you that currently we have $51,688.95 of unallocated funds. We have a little bit more actual dollars still sitting here that are things that we've allocated but haven't been quite spent yet. So what this software does, so we have previously authorized a grant to Amelia's House. They are a sober living house here in Waushara County. And so they were approved to get first month's rent for a number of individuals. And so they have taken advantage of that a couple of times. They have not used their whole allocation on that yet. So that's why the allocated amount is like more than what is less than what we have actually. And because they send us the things when they have one. They've been very good partners with us. There's been a couple instances where they've put in a request for first month's rent. And then because the individuals ran into issues and were told to leave the sober living, they called me and said they only stayed here a day. Please don't process my request. And so they haven't, they haven't tried to take advantage of us. So in talking to Patty, what this software would do for them, it would track their tenants, their rent payments, their programming, any type of meetings, any type of work things that they're doing, any type of payments that they're making, where they're getting other grant dollars, so that they would be able to have better statistics, and then be able to like share that with individuals, whether it's their treatment providers, their probation agents, the treatment court if they're participating in treatment court. Plus, it would give them better accountability when they're seeking additional funding from outside partners in order to keep the program going, so that hopefully it can become self-sustaining, or with partners help in like community donations and stuff. So they're requesting the $960 to purchase the program and pay for the first year, and then they would find money to do that afterwards.
Okay. Thank you. Ruth, does anybody want to make a motion to approve this? Yes. Pat, is there a second? Okay, second by Bart.
I've got a question.
Okay, is there any questions? Yeah.
All right. Was there like a monthly payment involved in that? I saw like.
This is the full amount that they're requesting, so that would pay for 1 year of it would be the initial installation, purchase, installation, and the 1 year licensing fee for it. But so that is the only thing that they've requested.
Okay. And the total was 900 something, you said?
$960.
Okay. All right. Thanks.
Okay. Is there any other questions? Okay. Seeing none, we'll proceed to vote. Yes. Pardon? Yes or no? No. Yes. Okay. Brandon, did you want to vote on this?
If you're trying to talk, you're muted, Brandon.
That's not us, is it? Lead reaction here. Yeah. Okay. Okay, very good. The motion passes. All right, number 2 is ARPA fund request, purchase of a no-till drill. Is there a motion?
I'll make a motion to table.
A motion to table?
Yes, sir.
Okay, is that to send back to committee or to table?
I would like to table it till we review more of the ARPA funds for what the needs are going to be needed at the sheriff's department.
Okay, is there a second to that table?
Okay.
Okay, we'll move on then. Is there a motion to approve? Okay, motion by Mr. Wadle, second by Mr. Piaski. Okay, is there a discussion? Motion by Mr. Wadle, second by Mr. Piaski. I'll just say too, I'm not in favor of buying this with ARPA money. I think the no-till drill probably is a good thing for the county, but I don't think it's prudent to buy it with ARPA money. So, is there any other discussion?
Yeah, I also agree with the same thing. I think the no-till is a good idea, but I think currently the sheriff's department is some dire needs of some funds. for repairs that need to be done that have been neglected for many, many years over there.
Mhm.
I'm not saying that we should not do the no-till. What my personal opinion is, I think we should just wait a couple months and just review what's going to happen over at the sheriff's department, make sure that we're allocating the ARPA funds correctly over there first before we allocate them with the no-till.
Okay. Is there any other discussion?
Yeah, just I'd like to note, as we've been discussing this in land water education, there was a reduction in ARPA funds that were designated already for the addressing the clean water, our reverse osmosis systems, and so the reallocating of this with the potential of purchasing the no-till drill, it's less than offsetting it as far as the funds that weren't used towards the water initiative.
I would just point out at the beginning of the, when the ARPA funds were allocated, the rules were much stricter and they got to be less, and that's why things have gotten allocated the way they have. So I don't know, it may have been the same allocation in the beginning anyway, I don't know, but that's the reality. So any other discussion? Okay. Very good. And we got a motion and a second, so we'll proceed to vote.
Yes.
Yes. I have one question on this CASA that they get and was shunting in with them,
Pardon me?
the AFA walking stuff in there. And I wasn't sure how they were doing it or going on it at the time. And
Okay. All right. Very good. Thank you. We can maybe discuss that
yeah,
further. Yeah, later. Okay. Let's see. We got, it looks like the motion carries. So, all right, we'll move on to the next, creation of a strategic planning standing committee. Is there a motion? Motion by Mr. King. Is there a second? Second by Mr. Urban. Is there any discussion? Okay, hearing none, we'll proceed to vote.
Yes.
yes,
Okay, the motion carries. Very good. Part C, consideration possible action on the following resolution. Resolution number 16-09-23, the resolution allowing participation in the Wisconsin County Fish and Game Project. Is there a motion to approve? Motion by Mr. Piaski, second by Mr. Wadle. Is there any discussion? Okay, hearing none, we'll vote.
Yes.
yeah. Me,
We got you, Brandon. Thank you. Okay, the motion passes. All right, very good. All right, now we're down to appointments. The confirmation of the chair's appointments to the Strategic Planning Committee, and that'd be Jessica Yeager, our county treasurer, John Jarvis, county board chair, Keith Melvin, EMS chief, Bart Peterson, county board supervisor, Bill Rosenau, veteran service officer, Jesse Urban, county board supervisor. Is there a motion to approve? Okay, motion by Mr. Bossard. Is there a second? Second by Mr. King. Is there any discussion? Okay, we'll vote on this.
Yes.
yes,
Okay, the appointments are approved. All right, and number 2, Aging and Disability Resource Center Governing Board. Mariana Larson Neshkoro, term October 1st, 2023 through September 30th, 2026. And, Catherine Bagdanoff Neshkoro, her term as well as October 1st, 2023 through September 30th, 2026. Is there a motion to approve? Motion by Mr. Piaski, second by Mr. Bossard. Is there any discussion?
Is that just that their address is Neshkoro or they're actually living in Marquette County? Or doesn't that matter?
I have no idea. I guess they must have to live within the county. I'm not sure.
This is one of our multi-county boards. So I'm not sure if they're in Marquette County or Washera, but we're-
Just point someone from.
but Marquette County is part of our
Okay, so
consortium.
then we could.
Yeah.
Okay, all right. Very good.
Thank
Thank
you.
you. Thanks for pointing that out. All right, we'll vote on that then.
Yes.
Yes. Okay, and those appointments as well are approved. All right, Part E, a proclamation recognizing September 2023 as Juror Appreciation Month. Is there a motion? Motion by Mr. King, second by Mr. Peterson. Is there any discussion on this? All right, hearing none, we'll vote, proceed to vote.
Yes.
See it? Okay, very good. That proclamation is approved. All right, we're down to the board suggestions for future agenda items. Is there any agenda items anybody has? Okay, hearing none, then I would look for a motion to adjourn.
Motion.
Okay, a motion by Mr. Bonfiglio. Is there a second? Second by Mr. Urban. Very good. We're adjourned. Thank you guys very much.
Can you let me know when that is? And then we can. That person, like, scripture.
Oh, yes.
Things like that, so then I can amend the bylaws, but I'll try to come to that person so that we can talk about it.
All right, sounds good.
All right.
Yep, we'll do that for sure. And actually, I can tell you right now, we're going to be meeting the 3rd. Strategic planning.
Can be here tomorrow?
That is.
Can be here tomorrow?
Wow, well, we knew that.
You'll be here
Hey,
tomorrow, so you
I'm
don't have to be
sorry,
here
Mr.
Thursday,
Rich,
is what he's
25
saying.
years.
And you're gonna run it Thursday.
Thank you. for what you do, too. I'm sure people tell you that every day.
I don't know if it's.
Well, I do appreciate it. We know we have to do that.
No, okay.
Well, we might have to shut the thing down for a while.
It's interesting.
Yeah.
I'll tell you that.
That's never a dull moment.
No, it is. All right, there's on my calendar, so.
Okay. Very good.
All right.
Thank you. Yep.
How are you?
Hey, Bart. We won't know until about middle of October.
Oh, they're probably gonna be like.
Well, every year we get different quotes from different people. So like GHT will quote